In the previous few chapters, we discussed genetic testing for chromosome conditions in the baby. In this chapter, we will shift to a different genetic testing topic, genetic disease carrier testing. This is a blood test used to identify couples at risk to have a child with certain rare genetic conditions. Let's start with a little bit of background information. Some rare genetic conditions are passed through the family when both a biological mother and father are genetic disease carriers. In these instances, the couple has a 25% chance to have a child with the disease. Carriers usually don't have any health concerns, and the couples do not realize they are at risk to have children with genetic conditions. Though these genetic diseases are rare, some diseases are more common in certain ethnic groups. For example, cystic fibrosis is an inherited lung disease that is more common in Caucasian individuals. Without a family history, about 4% of Caucasians are cystic fibrosis carriers. Again, being a carrier doesn't mean anything for that person, but if a mom and dad are both cystic fibrosis carriers, there is a higher chance their baby could have the disease. There are other conditions more common to other ethnic groups, such as thalassemia in patients of Asian or Mediterranean backgrounds, Tay-Sachs and Canavan disease for those of Ashkenazi Jewish background. Testing offered is based on your ethnic background. Genetic disease carrier screening is a blood test to see if a parent is a carrier. This blood test does not tell us anything about the pregnancy, only the carrier status of the parent. Usually we start with testing the mother. If the mother is a carrier, we will offer the father carrier testing for that condition. Sometimes both parents will have testing at the same time. What do the results of genetic carrier testing mean? A negative test means the chance a parent is a carrier is lower. We can't rule out that a person is a carrier, but odds are low, and the odds the baby has the disease are lower too. A positive test result means the parent is a carrier. If both parents are carriers, we offer diagnostic testing such as CVS and amniocentesis. Finally, with recent advances in technology, there are expanded genetic carrier testing panels. This blood test can test to see if one may be a carrier for a large number of genetic diseases. This testing is not currently standard of care, but is an option if you would like more information about your risks. If you are interested in more information or have questions, please talk with your provider or genetic counselor.